when the pandemic first broke out, it was kind of like presented as an old people issue, for lack of better words. What role can young people play in reducing these numbers?
Yeah, well, thanks for bringing this up. You know, the first thing is to understand how this virus spreads, to learn a little bit.
Mm,
And it's not that complicated. It spreads when people talk, cough, sneeze, sing, speak. Little particles that are invisible come out of our mouths and noses. And if you're within 6 feet of someone, the closer you are, the higher risk you are for having those particles land on your face. You breathe them into your mouth or nose, and it starts to multiply. So close contact with other people is the risk factor. That is, you know, if we don't have close contact, the virus can't spread. So
mm,
the number of close contacts you have, the number of social contacts you have, and how close you are to other people during those contacts, and how long those contacts last, all influence
oh,
risk of becoming infected. So fewer contacts, fewer social contacts, shorter duration social contacts, and social contacts that give us that distancing, all are, you know, important to understand because they relate to risk. So
mm-hmm.
fewer contacts, shorter contacts, and keeping that distance will decrease the risk. The other thing to consider is ventilation, because these little particles can get trapped in an area where there's not good airflow. So that's why we say outdoors, the risk is relatively low, especially if you're keeping a few feet away from one another. In other settings, it's really important also to use a face covering, because the vast majority of these infections are spread before people have symptoms and even know that they're ill. This is the tricky thing. So we can feel great. We think we're you know, as healthy as ever. And at that time, the virus can be multiplying in our bodies, coming out of our mouths and nose and infecting the airspace and the people around us. And then 2 days later, after we become ill, everyone that's been in contact with us during the last couple of days and the next few days are at high risk for becoming infected.
Mm-hmm.
So the other key thing to know is, in addition to the number of social contacts and how close you are and how long those contacts last, and the ventilation, is whether or not a mask is being worn, because the mask will prevent that virus from spreading before someone knows they're ill, and it protects the others in the environment. So if I wear a mask, it protects you. If you wear a mask, it protects me. Masks may offer some protection to the person who wears it, but the main reason is to protect other people in the community.
Mm.